Uplizna 10 mg per milliliter intravenous solution antineoplastic monoclonal antibodies are used to treat a specific nervous system disorder that affects the optic nerve and spinal cord, known as neuromyelitis optica spectrum disorder, NMOSD. These antibodies work by preventing immune system cells from attacking the nerves in the brain and spinal cord, which may help reduce the risk of attacks and delay or slow disability. It is important to take this medication as directed by your healthcare provider for the best results. Before starting Uplizna 10 mg per milliliter intravenous solution, make sure to read the medication guide provided by your pharmacist. Your doctor may also direct you to take other medications before each dose to help prevent side effects. The medication is given by slow injection into a vein by a healthcare professional, usually over about 90 minutes. The first 2 doses are usually given 2 weeks apart, and later doses are usually given every 6 months. Be sure to tell your healthcare professional if you experience any symptoms during or after the injection, and also inform your doctor if your condition does not improve or worsens. If you experience joint pain, back pain, or headache, it's important to let your doctor know. This medication may lower your ability to fight infections, so be aware of any signs of infection such as a sore throat, fever, chills, cough, or painful/frequent urination. It's important to seek medical help right away if you experience clumsiness, loss of coordination, weakness, a sudden change in your thinking, difficulty talking/walking, seizure, or vision changes. While a serious allergic reaction to this drug is rare, it's important to seek medical help if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing. If you experience any other effects, it's important to contact your doctor or pharmacist. Before starting treatment with Uplizna, make sure to tell your doctor or pharmacist about any allergies you have, as this medication may contain inactive ingredients that could cause allergic reactions. It's important to also inform your doctor about your medical history, especially if you currently have or recently had an infection, such as hepatitis B. Uplizna may increase your risk of getting infections or worsen current infections. Avoid contact with anyone who has a contagious infection like chickenpox, COVID-19, measles, or the flu. If you have been exposed to an infection, be sure to talk to your doctor for more information. Before starting treatment with Uplizna, discuss your vaccine history with your doctor and find out if you need to get any vaccines. Your doctor may advise you to get any necessary vaccines at least 4 weeks before starting this medication. It's important to avoid contact with people who have recently received live vaccines, such as the flu vaccine inhaled through the nose. If you have surgery planned, be sure to inform your doctor or dentist about all the medications and products you use, including prescription drugs, over-the-counter drugs, and herbal products. If you are pregnant or planning to become pregnant, it's important to talk to your doctor about reliable forms of birth control to use while using Uplizna and for 6 months after the last dose. Uplizna may harm an unborn baby, so it's crucial to discuss the risks and benefits with your doctor if you become pregnant while using this medication. It's not known if Uplizna passes into breast milk, so it's recommended to consult your doctor before breastfeeding while using this medication and for at least 6 months after the last dose. It's important to be aware of potential drug interactions when taking Uplizna 10 mg per milliliter intravenous solution antineoplastic monoclonal antibodies. This medication may interact with other drugs that weaken the immune system or increase the risk of infection, such as natalizumab and rituximab. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. Always consult with your doctor before starting, stopping, or changing the dosage of any medicines. If someone has taken too much Uplizna and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center for assistance. Before starting Uplizna, you will need to undergo certain lab and/or medical tests, such as a complete blood count and tests for hepatitis B. It is important to keep all medical and lab appointments while using this medication. Make sure to take each dose of Uplizna 10 mg per milliliter intravenous solution antineoplastic monoclonal antibodies as directed by your doctor. If you happen to miss a dose, consult your doctor or pharmacist for a new dosing schedule. This medication, Uplizna, is administered as an intravenous solution in a clinic or hospital setting. It is not meant to be stored or used at home. Uplizna is used to treat neuromyelitis optica spectrum disorder, NMOSD, in adult patients. It is given at a dosage of 300 mg every 2 weeks for the first 3 doses, followed by a maintenance dose of 300 mg once every 4 weeks. The optimal timing for taking Uplizna will be determined by your healthcare provider. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.